It's very important for our patients to understand how to avoid complications and how we as surgeons avoid complications. A lot of this stuff is under our control. Okay, so I'm going to list all the possible complications associated with bariatric surgery. Number one, top of the list, blood clots. Blood clots in the legs that can travel to the lungs, also called deep venous thrombosis and pulmonary embolus. We want patients up and walking and moving after surgery. We don't want them staying in bed for a long time because of the risk of blood clots. When they go home, we want them walking around the house every hour or two. We want them staying mobile and active. Patients cannot lift anything over 20 pounds for 3 weeks in order to protect the incisions from hernia formation. But again, it's important to stay active. We also discharge patients with sequential compression devices in order to keep blood flow circulating and to prevent blood clots. The risk of infection of the incisions is fairly low. The incisions have skin glue on them. No sutures, bandages, or staples in most cases. Patients can shower on the first day after surgery. We don't want patients submerging the incisions in water for 3 weeks, so no baths, no swimming, showers only. The risk of bleeding is fairly low. The risk of having to have a blood transfusion, very low. This is not an operation associated with a lot of blood loss. We may lose 10 cc's of blood during the operation, and that's not typically a very high risk at all for patients. The risk of a leak from the stomach, this is the most serious complication. We're very careful about leaks. We do 2 tests in the operating room. We do not leave the operating room unless those tests are completely normal. We've had great success preventing leaks from the stomach. The risk of malnutrition, patients need to take protein and vitamins every day in the amounts we recommend. If they do that, they're not going to get malnourished. It's as simple as that. We check nutritional parameters and lab work every 3 months to make sure patients are healthy. We typically don't start vitamins the first week. We may start them the second or even third week. They can pick them up from our office. They need to be bariatric vitamins, specifically for bariatric patients, not a generic multivitamin that doesn't have enough of the vitamins that bariatric patients need. In our operations that include both the stomach and the small intestine, so gastric bypass and duodenal switch, as I mentioned, there are more rules to follow. Those rules, of course, seek to avoid complications. And so there are 4 of them. The first is stenosis. In gastric bypass, if the connection between the stomach and the small intestine forms a bit of scar tissue, that opening can become a little bit narrow. Weeks 5 to 8 after surgery, as patients are advancing their diet on, if patients recognize that things are a little bit slow in getting down, the first thing that we recommend, of course, is for patients to take small bites, chew their food very, very well before they swallow. If they still are having that problem, we may need to put a little balloon down with endoscopy, stretch it out a little bit, and that's usually all that is required. The risk of marginal ulcer formation after gastric bypass, a patient cannot take aspirin, ibuprofen, or naproxen, Aleve for the rest of their lives. Those are classified as NSAIDs. Those are off limits. They can cause ulcers in gastric bypass patients. We have patients take Protonix or pantoprazole, which is an acid-reducing medication, once a day consistently for 1 year after surgery. Extremely important medication to have on board to prevent ulcers. Smoking is the biggest risk factor for ulcers. And of course, smoking cessation is extremely important for any patient looking at having bariatric surgery. The risk of dumping syndrome, high sugar foods can cause patients to feel sick after gastric bypass. They can have short episodes of nausea, lightheadedness, maybe some abdominal pain, much like a hypoglycemic episode in diabetic patients, and that's called dumping syndrome, usually from high carbohydrate loads. So there may be some desserts that patients previously enjoyed that they can no longer have if they've had gastric bypass. The risk of bowel obstruction, spaces are created in the abdomen when we perform gastric bypass and duodenal switch. The intestine can slip through those spaces and become entrapped. We close those spaces during every operation It's a very important part of those operations. If we close those spaces, the chance of them opening and that happening is very, very low, okay, post-operatively. What we want to emphasize with this issue of bowel obstruction is that after patients have bariatric surgery, any abdominal complaints, abdominal pain, nausea, constipation, bloating, those complaints need to be addressed by your bariatric surgeon, not by a primary care physician or an ER physician that may not know how to manage bariatric problems. They always need to come back to us as your bariatric surgeon.